Today, a public hearing focused on the state's 2023 budget and its impact on early child care and learning. It was held by the House Children and Families Finance and Policy Committee. Several Minnesotans shared ideas for steps lawmakers can take to cut costs for families. Let's take you there now and hear what they had to say.
In 2021, the state established a Great Start for All Minnesota Children Task Force by the then DFL Majority House and GOP Majority Senate to establish 3 goals. And you'll see them, those who can see the slides anyway, 3 goals listed. One relating to affordability, a system where our family costs for this critical service are affordable. Another one, accessibility, making sure that access is not determined by the child's income in particular, but also where they live in the state and their race. And then thirdly, that the people who do this work are compensated equitably and that they can actually support themselves in the work that they do. So we did a lot regarding access, investing in a number of different programs to address child care and early learning, including child care assistance, early learning scholarships, Head Start, and school-based pre-K. These programs and those investments were, in general, aimed at kids from the lowest income and the most vulnerable families. And generally, that's the lowest 25% of incomes. We also invested in compensation through the Great Start compensation supports to increase wages and other workforce supports. So if you are just thinking, I'd said affordability, access, and compensation. We've got access, we've got compensation. Something that was not addressed so much this past spring was affordability for families. There was a proposal that was heard in another committee for child independent care tax credit, and that's something that did not end up advancing. And so we did a lot for access, a lot for compensation, less so for affordability.
My daughter is extremely smart. I blame it on her child care center, Iron Range Tykes. It's why I drive 15 miles there in the morning to drop her off, 15 miles back home to work remotely, and I do the same thing when my workday is done. Because of the education she is getting, it is incredible. We have a few other options for childcare a little closer to home, but they are not high-quality options, and sadly, I would have concerns for my child's safety if I sent her to one of them. Even just a small dip in quality can really be scary, which is why I believe so strongly that the high-quality childcare should be available for all Minnesota families. Unfortunately, as you all are aware, that's far from our reality. My husband works as a miner, and I work remotely in healthcare supply chain management. We waited until we were in our 30s to start a family and financially stable. It is not an exaggeration to say that the decision was based on the cost of childcare. She is our only child, and unless something changes in the cost of childcare, she will remain our only child. We pay more for childcare than we do our mortgage, and there's no way we could double that and still afford to live.
Providing high-quality childcare is incredibly expensive. I just notified my families that we have to raise our rates to make ends meet because the cost of everything has gone up. Every time we raise our rates, we naturally lose families because they have to weigh the costs. At what point do they not make enough money to pay for childcare? At what point do they decide that in order to make ends meet, they need to find a childcare option that has much lower quality? This is a horrible decision to be forced to make. I have a family of 6 who recently pulled 3 of their 4 children from my center because of the cost. They found alternative care options of grandparents and relatives for those 3 children in order to afford the weekly tuition for just 1 child. To add to that frustration, this family, and 98% of all of my families I provide care for, have what are considered to be great jobs in the rural area. They work in mining and healthcare. But these great jobs are not enough for them to afford their lives, and childcare costs are a huge part of that.
If you have a leaky roof, do you just patch it and hope for the best, or do you stop the leak, fix the problem, and prevent future damage? This is it. It's now or never. Because I can tell you that the childcare providers won't be here when you finally put those preventative measures in place. And it will all have been for nothing, and the damage will have already been done. Last session, we put money into helping the teachers receive higher wages. We made the Great Start compensation payments permanent. We put money into the Child Care Assistance Program and early learning scholarships. We got people who qualify for CCAP off the wait list. For this, we are extremely grateful. That was a decent patch on a big leak for the Twin Cities. However, the CCAP rates in rural Minnesota didn't change. because they were based on pre-pandemic rates from almost 4 years ago. Here's the problem. We price the private pay families, or any family of 4 making more than $55,000 a year, out of the market. And one of those parents are now staying home because the average cost of care in rural Minnesota for an infant is $17,000 a year. In the Twin Cities, over $21,000 a year. It's cheaper to stay home. You are losing your workforce every day. Every week, I get another family leaving my center to find cheaper, more affordable care. And when they realize it doesn't exist, they choose to stay home. And when I don't have enough children, I can't operate. The local public school in my area opened up a preschool in their school this year. They hired high school students at $15 an hour. They hired union bachelor degree teachers. They have school readiness resources like counselors, nurses, administration, professional development. I lost over 50% of my preschool class to this new program. Why? Because it's $100 a week less than what I charge.